Hello friends, welcome back to my channel. Myself Monica, and after a long time, I am uploading this video. So I have finally reached my final year, and you know how hectic final year is. So I was not able to take time to make new videos, but now I have finally got this time. So I'm bringing you my very first video from my final year, that is partograph. It's one of the very, as I always say, every topics that I tell you, I share with you are important, and this is again another important topic. And what I want you to understand is that if you want to understand this topic really well, then the one thing that you must do is once you have to go and see a normal delivery, because until and unless you see that, you cannot understand whatever I have said here. Maybe you might mug them up and learn it, but what you learn by actually looking at the situation, it's totally different. This is my personal experience, so I'm telling you, I had my teacher, this they taught me this in class, and at that time I had not been to a labor room, and I haven't seen a delivery and everything. But once I saw that, I totally, I could get every steps of them. Well, I could just understand the every steps that was said in this partograph. So I will make this video part by part. One part I will describe one part of the partograph, that is labor. Then in next video maybe amniotic fluid. Next video will be contractions, because if I make one video only keeping everything together, it will be very very long. And so that's why I've just made it, I'll make it in parts. So today the thing that we will discuss is the fetal heart rate per minute. Okay, so this is what we are gonna talk about today. So this is a partograph. You can see here, you can see similar partograph in your college also. This is a partograph of my college, medical college. Here in the beginning you have to write the name of the patient, age, then you have to write the gravita, parity, hospital number, date of admission, time of admission, and ruptured membrane, yes or no. If yes, then date and time, and true labor pain start date time, you have to write it here. Okay, this is what everything about the patient particulars. After that, you can see this graph where one half is about fetal heart rate, the next part is about amniotic fluid molding, the next part is about cervix, descent, head plot, then contractions, then oxytocin, drugs, pulse, pp, temperature, protein, and urine output. This partogram really helps you to assess how how this labor is going on, what is the situation of a woman, how are her contractions, what is the situation of the fetus, is that fetus in any distress or not. So that's why it's so important to know to plot a partograph. First, let's us understand what is a partograph. So partograph, it is a composite graphical record of the vital data of mother and fetus during the labor, plotted against time on a single sheet of paper. So let me repeat it. It is a composite graphical record. Obviously we are doing in a graph, so that's why a graphical record of the vital data. Okay, heart rate, pulse rate, temperature, pp, contractions, and fetus during the labor, plotted against time, because we are doing in on time basis on a single sheet of paper. Now next thing is, what is the normal fetal heart rate? The normal fetal heart rate, since we are going to talk about the fetal heart rate, so let's go directly into that topic. So the normal fetal heart rate is 110 to 160 beats per minute. It helps to assess the condition of the fetus inside the womb. Okay, so what is the importance of fetus heart rate? It helps to assess the condition of fetus. And why is it necessary to be plotted in partograph? Why are we plotting it? And why is necessary to know the fetal heart rate? Once I said the condition of fetus, so why during the labor we have to know the condition of fetus? Other time that we don't do it, we don't access the fetal heart rate in a partograph in other times, or in the maybe latent phase of labor or earlier than that, is because during the active phase of labor, when the labor starts, there is uterine contractions that might decrease the flow to the placenta, and that will cause a reduced oxygen supply to fetus, resulting in a fetal distress. That is why when you see that when the woman is going through a lot of contractions, especially in her second stage, okay, there the people around her, like especially the nurses, they will be checking the fetal heart rate after her every contractions. Okay, because of this reason, if you go to a labor room, if you see a process of whole labor, you will understand this very very well. So now the before going to this, let me explain you how you are gonna plot this chart. So now at first you get from here the fetal heart rate starts. So this is 80, 90, 100, 120 to 200. At first, the first time, okay, the 0 minute where you will access the fetal heart rate. So maybe suppose at the 0 minute the fetal heart rate is around 120. So you will plot it here like with this dot. Okay, now after this small box is 30-minute box, and this box is again 30 minutes. So this box as a whole makes a 1 hour. Okay, so let me tell it once again. This small box means 30 minutes, and this small box means 30 minutes, and when you combine this whole box, it will be a 1 hour time. So you have to access the fetal heart rate, especially on your first stage of labor, first active stage of labor, at every 30 minutes. Okay, this we will do at every 30 minutes. And after that, when you have completed a partogram, when she has gone to second stage of labor, that time at the delivery room only, labor room only, she will check the fetal heart rate with every part of contraction, and she will be informing to the doctor. So in this time, at 0 minute you will plot the value. After that, since I said this is small boxes of 30 minutes, so after 30 minutes you will again plot the value. Maybe it's around like 130, so you will plot it here. Okay, then after 30 minutes you will plot, maybe it's around like 120 only, so you will plot it here like this. After that, maybe again half an hour, like 30 minutes, maybe it's here at 140 beats per minute. You will plot it like this, and then you will draw a line like this, and this is how you will plot the fetal heart rate per minute in a partograph. And now if now we are done with the plotting part, this is only the things that you should know. You have to plot the fetal heart rate at every 30 minutes time, every 30 minutes of time. Initially 0 minute, then at every 30 minutes you're gonna plot it. So I have forgot to explain something which I had to do before. That is that when do we start to actually plot on the partograph? So we start it at the active phase in the first stage of the labor. We all know the stages of labor: first, second, third, and fourth. And in the first stage there is a passive phase and the active phase. The passive phase lasts from the onset of two labor pains to the 4 centimeter dilation of the cervix, whereas the active phase starts from 4 centimeter, when 4 centimeter dilates, up to the 10 centimeter dilatation of the cervix. So what happens usually is the time period for the passive phase is around like 8 hours to 12 hours. So that's a very long time, and in that 8 to 12 hours long time, if you start to plot on the partograph, your partograph is gonna go very very long. Okay, it's even one paper will not be sufficient. It will be like a ACG paper, very very long, and it is very tiring also and not effective. So usually we start to do our partograph from the active phase of the labor, when the cervix is already 4 centimeter dilated. From there we will plot till the cervix is 10 centimeter dilated, because that interval is quite short, around like 4 to 6 hours. So that is why the partograph plotting starts from the active stage of the fourth stage of labor. Now let's see for the more questions related with it, what can be asked. So the second question that we have to know is, which women are considered to have which women are considered to have a risk of fetal distress. So you have to also know, especially in some cases where the woman may be in certain situation where the chances of fetal distress is highly high. Okay, so that things you have to know so that you can have a proper monitoring of the fetal heart rate, the fetal situation, the mother situation. So some of the conditions are women with medical problems during pregnancy like eclampsia, chronic hypertension, antepartum bleeding, and diabetes. Next one is women who smoke. Okay, women with slow fetal growth or oligohydramnios, women with clinical signs indicating chorioamnionitis, okay, like fever, abdominal tenderness, offensive vaginal discharge, women with meconium stained amniotic fluid, and women with poor progress in labor. So these are the women who are gonna have a risk of the fetal distress. So you should know the situation, okay, which are highly risky for the fetal distress. So that's the point number 3. Now let's go to another question. So how often the fetal heart rate will be monitored in case of fetal distress? I have previously talked about the normal situation where we will monitor in every 30 minutes. But if there is a situation, and especially like of these high risk people, then we have to change the time period, and in every 50 minutes we have to measure the fetal heart rate, okay, when there is a distress, and directly after every bout of maternal pushing during second stage of labor. This we will do in the normal situation also, like when this is the second stage of labor, the nursing people there, they measure the heart rate after every bouts of maternal pushing. And now, since there is a heart rate, we have always talked about in adult situation what is the cause of tachycardia, what is the cause of bradycardia. So similarly, we have also to know that we should also know the causes of fetal bradycardia in the fetus. So the causes of bradycardia are means the heart rate is less than 110 beats per minute, and the reasons are fetal hypoxia, acidosis, fetal sepsis, anomalies, use of local anesthetic drugs, epidural anesthesia, drugs to mother like betadine, antihypertensive drugs like methyl-dopa propranolol, MGSFO, fetal heart conduction defect, okay, like SLE, and maternal causes are like hypoglycemia and hypothermia. So these regions can lead to a fetal bradycardia. So we have to also know these causes, especially for our being a doctor and also for our exams. So what are the causes of fetal tachycardia? Fetal tachycardia, this is maternal causes. So maternal causes, there is like hyperthyroidism, or the metabolic acidemia, infections like both maternal and fetal infections, anemia, both maternal and fetal, if they are suffering from anemia, fetal hypoxia, or drugs to mother like beta sympathomimetic agent, or vagolytic like atropine. So if the mother is consuming such drugs, then the chances of fetal tachycardia. And I'm telling you that you will see a lot of cases of mother with eclampsia, hypertension, diabetes, so you have to be like, it's a very common thing in the maternity ward. I had this mother who was suffering from hypothyroidism, and that had resulted in a fetal tachycardia. So that's about it. So this is just about the this is just about the plotting of fetal heart rate in a partograph, and I have just answered few of the questions. In the next video we will talk about amniotic field molding and cervix and descent of the head plotting. Okay, this is the very important one, and other topics also. So I hope that you like this video. If you have any confusion, you can comment down in the comment box. Thank you so much.